Hi RT students. All right, we've been doing PFTs for the last couple of weeks. Today, I am just going to give you a complete PFT and you're going to tell me what's wrong with it, okay? If anything. All right, so let's see what we've got. We have a 32-year-old, 69-inch female patient. That's all that we know. Okay, let's get acclimated to the chart. Here's everything we're measuring. So you can see we're measuring flows and then we're measuring volume, and now we have a DLCO. This is what the patient is predicted to do. So the computer says, well, a 32-year-old female that is 69 inches should be able to do these values. This is what, when we actually perform these tests, the pre-SVM value or the pre-bronchodilator. This is the post-bronchodilator. Okay, so we got the pre-bronchodilator values, we gave an SVN, a bronchodilator, and then we did the test again. And this is the percentage change of all of that. Okay, so this looks messy, this looks horrible, and you hate PFTs, and I get that, but here's how easy it is. The first thing you always do on your pre-SVN or pre-bronchodilator is find the FEV₁ and the FVC, and you divide them. So you could do the math here, but look, see how they already did this for you? FEV₁ divided by FVC, and this is 83%. Well, what does that tell us? This tells us there is not an obstruction. Okay, if it was less than 70%, there would be an obstructive disorder. There is not an obstruction. Okay, well, now we need to check for a restrictive disorder. All right, so also, since there's not an obstruction, I don't even care about reversibility. If there's not obstruction, there's nothing to reverse, okay? So they're not obstructed, so check for restriction. This means we're gonna come down here and we're gonna look at our FRCs. And if you look, they were supposed to do 3.5. Well, they're doing 3.4. That's pretty normal. RV 1.8, they're doing 1.7. Gosh, that's pretty normal. TLC 6.2, they're doing 6.1. That's normal. Okay, so now we know we're not obstructed. Well, we're not restricted either, right? Because these are normal. They're just a little bit off, and a little bit off doesn't matter. If they were 20% off, then it would make a difference. But these are barely moving from the normal values. And then when we look at DLCO, normal's 25, well, they're 26. This person doesn't have a restrictive disorder. So if they're not obstructive and they're not restrictive, what are they? This is an absolutely normal patient. And when you go to take your credentialing exams, they will give you normal patients because it trips everybody up. But if they're not obstructive and they're not restrictive, they must be normal. Hope this helps. See you soon.